Okay, we did our project on Parkinson's disease, and Parkinson's disease can be shorthanded as PD. And PD is characterized as the second most common neurodegenerative disease in the world today, and that is from Goetz 2011. This disease is associated with the degeneration of neurons that are involved in releasing the neurotransmitter dopamine. Dopamine is a molecule that it's going to help control the brain's reward and pleasure pathways, and that is from Goetz 2011. In addition, dopamine helps to regulate physical movements and emotions, and some of the common symptoms that patients tend to experience are tremors, speech changes, slowed movement, bodily stiffness, and changes in one's writing style. That is also from Goetz 2011. If we look at the history of Parkinson's disease, basically we can trace this back to 1817. And the first historical account of Parkinson's involves a man named James Parkinson, and he's the person who first documented a medical description of Parkinson's disease. And later on in that same century, in the 1800s, more scientific discourse was carried on by a man named John Martin Charcot, and Charcot played a big role in progressing the criteria for diagnosing people with this. That's from Goetz 2002, and he made it clear that there were traits associated with PD that were not present in several other neurodegenerative diseases at the time, such as multiple sclerosis and other tremor-causing diseases. As far as treatments go, like during the time of Charcot, treatments were pretty limited to something that was termed the belladonna method, which was a plant-based choline receptor inhibitor, which they saw that this helped patients with pretty severe symptoms and really helped to lessen that. And another common treatment during the days of Charcot was vibration therapy, and the way that Charcot started this kind of therapy was that he saw that people who had PD, who would go for rides in a horse carriage on a bumpy road, that their symptoms would get better just from the vibrations that would happen with that. And his therapy was just an attempt to mimic that kind of stimulation. But as history progressed, science's advances became more sophisticated, and science was able to deduce more specific causes. And they really just identified dopamine as kind of being a central factor for people who did have PD. And the role of dopamine had been studied enough to understand it, and pharmacology's advancements came up with ways to develop a variety of treatments that would target more choline receptors in the brain in the hopes of restoring proper dopamine levels. That is from Goetz 2011, and this would also just further aid in slowing the progression of PD and making the symptoms less debilitating. In addition to pharmacological drugs, basically, is dietary supplements, which have been proven to be really effective, especially pretty recently with all the research. And among these supplements are creatine, omega-3 fatty acids, coenzyme Q10, the B vitamins and especially B6, pyridoxal 5-phosphate, and carnitine. And these supplements have all been shown to really help quite a bit with people who have the symptoms, and to even like slow the progression quite significantly. That's from GOAP 2011 also. And the main factor that predisposes people to getting PD is still just like old age, and the group of people who are at risk of developing this tend to be people who are 60 years and older. That is from GOAP 2011 also. Okay, that's my part.
Okay. Approximately 50,000 to 60,000 new cases of PD are diagnosed a year in the United States, and that is from the National Parkinson's Foundation. PD is actually the 14th leading cause of death in the United States as well, and one of the most commonly known Parkinson's disease patients is Muhammad Ali. Muhammad Ali was actually diagnosed in 1984 when he was 42. He started showing signs of certain symptoms in 1981, right after he retired from boxing, but he wasn't actually diagnosed until 3 years later. It's believed that he got the disease because of so many blows to the head during his boxing career. He has actually opened up foundations for research and to help others who have Parkinson's disease as well. Another statistic is that 1 in 90 people have PD and have never been diagnosed. And that is also from the National Parkinson Foundation. And Yahoo aired an article called Facts and Figures about Parkinson's disease, and it said that 280 people die a week in the United States from Parkinson's disease, which is kind of scary. That's it. That's all I have.